my name is Jason and I'm currently a second year Anatomical Pathology Registrar at North Shore Hospital in Auckland. I was born and raised on the North Shore and attended medical school at the University of Auckland. After graduating, I spent 2 years rotating through different specialties within the wider Auckland region as a house officer before I started pathology training. For me personally, having grown up in Auckland, it made sense to stay where I have the largest support network, through friends, family, and colleagues. It was also the system I was most familiar with, and from a training perspective, being in the Auckland region means that you're exposed to 3 different hospitals with quite different demographics, ensuring you see a wider range of conditions and pathologies. Overall, Auckland has a great mix of breadth and depth of exposure to tertiary medicine given its large population, and also the freedom and space to enjoy life outside of work hours. For me, this means being able to go for a swim after work or keep up with hobbies such as keeping up with my music and taking part in local chamber or orchestral groups. The Auckland Pathology Program has been extremely supportive to trainees, with consultants very eager to guide and support us throughout our training. This includes support at cut-up dissection, double-heading cases, and supervising projects for conferences. As the largest group of anatomical pathology trainees in New Zealand, we are lucky enough to be able to arrange dedicated protected teaching time each week with a consultant in their chosen specialty interest. This has also allowed me to build up a strong support network with colleagues and fellow trainees, which will be great as we progress through training. There are multiple reasons why anatomical pathology is appealing. The medical aspect is very interesting to me, being able to look down a microscope or look at a specimen and be able to link the pathology we see with the clinical and human condition that the patient has. Every case you see is different, and even though clinicians may give you a clue as to their favored diagnosis, you never know what is in store when you look at the slide down the microscope. There's a puzzle or problem-solving element to it, as you are looking at tissue and trying to decipher what it is they have. It's a very rewarding job when you're able to provide an answer or reason for why a patient presents, or play a role in a patient's ongoing management. The highly collaborative and collegial environment was also a huge factor in choosing this specialty. Even though a lot of time is spent looking at cases yourself, a large component of anatomical pathology involves discussing with colleagues regarding difficult cases, asking for second opinions, and advice from others in the hospital or even experts from outside the country. Knowing that there are colleagues you can drop by and ask for support and advice, and in turn, knowing you can provide such assistance is a very important aspect of the role for me. The heavy multidisciplinary aspect is also a huge plus. A large role of pathology is diagnostics, as well as discussing with surgical, radiological, and oncological colleagues regarding diagnoses and ongoing management. The fact that it's an 8 to 5 without nights, long days, or weekends is also a huge plus. First thing to do is definitely to read up more about what anatomical pathology is like. It's a specialty unlike any other, especially since there is not much exposure as you go through medical school and as a house officer. There are a lot of resources online about what the job entails and what it's like. After that, reach out to your nearest lab to arrange a visit to get a feel for what the day-to-day looks like and chat with the consultants and trainees about how they find the job. We're a friendly bunch and would love to show you around. I find the opportunities to liaise with our clinical colleagues to enhance patient outcomes on a larger population scale very rewarding. An example is an audit on Barrett's esophagus reporting and follow-up, which required ongoing liaison with our gastroenterology colleagues. Through audits, we have the opportunity to inform clinicians about their outcomes on a larger population level, and as such, inform on further targets or areas of improvement to affect and reduce inequities within the system.